Whether during foreplay or the main act, fingers can be very pleasurable for a woman when used the right way. With the right technique, some women can even reach orgasm from just fingers alone. Fingers can bend, change pressure, adjust angles, and switch from one finger to two or three, making them precise tools that are easier to control than anything straight and firm. I'm Dr. Laura, urologist and men's health expert. Today I'll guide you through a clear, respectful, and medically based way to use your hands so the woman you're with feels safe, cared for, and deeply pleasured. First, two important things before any touch: consent and preparation. Ask clearly, do you want me to touch you here? Keep communication open the whole time. Then get your hands ready. Trim and smooth nails. Wash hands and under nails well with soap and warm water. Remove rings. If dryness is possible, keep an unscented water-based lubricant nearby. Clean hands prevent small scratches and lower infection risk. Lubricant prevents rubbing and discomfort. Step 1. Warming up and teasing. Arousal for many women is a full-body process, not a quick switch. Start away from the genitals. Make out, kiss her neck, collarbones, and inner arms. Stroke her lower back, hips, and outer thighs. As you get closer to her inner thighs, slow down. Over her clothes or underwear, press your palm softly over the vulva, and hold, then release. Trace the edges of her underwear fabric. The goal is steady, playful pressure that comes and goes, building anticipation. Teasing isn't just extra time, it's fuel. It increases blood flow to the clitoris, labia, and vaginal entrance, which makes touch feel stronger later. Step 2. Begin with external touch, slow and gentle, with underwear still on. Outline the outer lips and inner thighs with light strokes. When she says yes to skin, glide a fingertip along the outer lips, then the inner lips. Keep your touch slow and curious. Move around the hooded clitoris first, instead of touching the tip right away. Most women find the exposed clitoral glands too strong early on. Think soft strokes, then light circles, then slightly firmer ovals. Pay attention to her breathing, hip movements, and soft sounds. Those are signals to keep going. Step 3. Add rhythm around the clitoris. Every woman's sensitivity is unique, but many prefer smooth, steady patterns over random touches. Try a gentle circle around the clitoral hood, like moving around a clock face. Try vertical strokes from the pubic mound down to the vaginal entrance, then back up. Try sideways figure eights around the hood. Use 2 fingers for more surface contact, if she prefers it, or 1 fingertip for precise pressure, if she likes it focused. Ask short questions, softer or firmer, faster or slower, higher or lower. Step 4. When and how to go inside. Wetness means arousal, but doesn't always mean she's ready for penetration. Ask, do you want me inside? If yes, add lubricant if needed, and start with 1 finger. Never insert dry. Slowly slide into the vaginal opening, and pause just inside, to let her pelvic floor muscles relax. Use a slow come here motion toward the front wall, rather than quick in and out thrusts. Fingers are great for adjusting angles and pressure, not speed. Explore gently in all directions. If she tenses, pull back a little, breathe with her, and go back to external touch. Step 5. Finding the front sweet spot. It's 1 to 2 inches inside, on the front wall toward her belly. The tissue here may feel soft or a bit textured. This area, often called the G-spot, becomes more noticeable with arousal. Curl your finger toward it with a gentle come here motion. Begin with light taps or short strokes, adding pressure only if she wants it or her body leans into it. Many women enjoy steady, repeatable motions more than strength. Keep your other hand free to hold her hip, stroke her belly, or keep touching the clitoris with your thumb if she enjoys blended sensations. Step 6. Increase slowly with 2 fingers and better coordination. If she wants more fullness, pull back slightly, twist gently, and slide in 2 well-lubricated fingers together. Keep your fingers curled so your tips stay in contact with the front wall. Mix movements. The fingers inside can do a soft come here motion or small circles, while your thumb or other hand keeps a steady rhythm around the clitoral hood. Small movements make a big impact. The more aroused she gets, the less big motion you need. Pressure and steady touch become the key. Step 7. Adjust speed and pressure near climax. As she builds, her signals get stronger. Her hips push, breathing quickens, her sounds deepen, and her thighs may shake. When you find a pace and pressure her body is clearly enjoying, don't change it. Keep the rhythm the same through her release. If she says right there, treat it like a lighthouse mark. Stay steady. Many climaxes fade if the stimulation changes at the last moment. Step 8. Extra techniques many women love. Hood strokes. Use 2 fingers in a V shape to gently slide the clitoral hood up and down without fully exposing the tip. Outer to inner wave. Long strokes from outer thighs to inner thighs to labia, then back out, which resets sensitivity. Pressure hold. Rest a warm broad palm gently over the vulva with still pressure, very calming between peaks. Angle change. Place a small pillow under her hips to tilt her pelvis, making it easier to reach the front wall with your fingertips. Step 9. Comfort and hygiene tips. Short nails, clean hands, and lube help prevent tiny tears. If you go from anal play back to the vulva or vagina, wash thoroughly or change gloves first. If she feels burning or pain, stop, use more lube, and return to external touch. Sharp pain is always a no. Warmth or light stretching is fine only if she agrees. Step 10. Talking and aftercare. After she finishes, keep your touch steady but lighten your pressure as her body relaxes. Many women love being cuddled, stroked along their ribs or hair, or having their thighs lightly massaged. Offer her water. Later, ask a simple question. What did you like most? Remember her answer. This is your real guide. Here are some truths most men don't hear. Not every woman reaches orgasm from internal touch, and that's completely normal. Many prefer clitoral focus only, while others enjoy a mix. The only way to know is to watch, listen, and ask. Emotional comfort matters most. When she feels safe, valued, and not rushed, blood flow and natural lubrication improve, pelvic muscles relax, and pleasure increases. If this guide helped you, share it with someone who wants real, respectful advice. Your hands can become amazing tools when used with patience, skill, and care. For men looking for even more support, there are natural supplements that can help. 2 that I often suggest are organic watermelon extract, rich in citrulline to boost nitric oxide and circulation, and an advanced blend of ashwagandha, tonkat ali, fenugreek, nettle, and citrulline to support all areas of men's health, from erections and energy to testosterone and prostate care. Links are in the comments and description. Step 1. Warming up and teasing. Arousal for many women is a full-body journey, not a quick switch. Start away from her genitals. Make out, kiss her neck, collarbones, and inner arms. Stroke her lower back, hips, and outer thighs. As you reach her inner thighs, slow your pace. Over her clothes or underwear, gently press your palm over the vulva and hold, then release. Trace the edges of her underwear fabric. The goal is steady, playful pressure that comes and goes, building anticipation. Teasing isn't just extra time, it's fuel. It increases blood flow to the clitoris, labia, and vaginal entrance, making every touch stronger later. Step 2. Start with external touch.